Over 70% of patients in Bauchi North get life-saving oxygen from new plants. Over the years, since the outbreak of COVID-19 pandemic, the death rate of children under 5 in Bauchi State has increased due to the lack of oxygen facility in many primary and secondary hospitals, has been a concern for the government.
You agree with me that more than 70% of the population can access the highest level of healthcare services they can access is the secondary facility.
The chairman Bauchi State Hospital Management Board, Dr. Samuel Ali, while briefing a team of journalists on a facility tour to assess the impact progress of the plan since its commissioning last year.
Agree with me, maybe you must have visited the plan. The plan is situated in General Hospital Azare and is functional. Functional in the sense that since commencement, it requires a lot of technicality, a lot of other facilities to be in place. So what we did is to go into MOU with the Federal Medical Center, whereby we know that they have all the technical know-how, and they have the functional units to utilize this oxygen, and we started engaging them. So currently, what I'm saying is the general hospital utilizing the oxygen, and secondly, we supply the Federal Medical Center, and it's really working perfectly.
While responding to questions about the sustainability of the oxygen plant, Dr. Sambo informed journalists that all necessary arrangement has been put in place.
Go into MOU with the Federal Medical Center, whereby we know that they have all the technical know-how, and they have the functional units to utilize this oxygen, and we started engaging them. So currently, what I'm saying is the general hospital utilizing the oxygen, and secondly, we supply the Federal Medical Center, and it's really working perfectly. And the next step is we are working to ensure that we expand the services to reach to the nearby general hospitals.
Dr. Bello Idris, a medical officer and in charge of the General Hospital Azare, emphasized the importance of oxygen therapy in treating patients with respiratory diseases and calls for the government support. Plant's biometric engineer Philip Gabriel said that despite some challenges, the plant has the capacity to produce oxygen daily depending on the consumption and demand. Addressing journalists on behalf of the donors, the UNICEF Bauchi field officer, Dr. David Audu, said that the oxygen plant has become a game changer for healthcare system in the entire Bauchi state.
The oxygen plants have been impactful in saving lives in this facility because neonatal mortalities and children with pneumonia, childhood pneumonia being one of the leading cause of children mortality in this our environment, has been drastically reduced because of availability of oxygen.
Okay, major challenge we are experiencing is actually power supply. Currently, we are running 24 hours. Anytime we want to run the system, we use generator, which is highly not cost effective due to the high cost of diesel. So one of the recommendations we're making is to provide solar power system to enable this system run effectively.
A key component of the management is oxygen therapy, and then that is missing in majority of primary healthcare centers and majority of our states. So the pneumonia is the big one out there because it causes a lot of death, but then there are other respiratory chronic and acute respiratory disorders that oxygen is a component in their management.